Dr. Winkfield, before COVID, Black and white cancer disparities were narrowing amid progress against common malignancies. What impact do you think the pandemic has had on that progress? Has there been any backslide in that?
Yeah, it's a great question. We know that there was a lot of fear around getting screenings done during the COVID pandemic. In fact, access was restricted. We know that as well. Some of the screening facilities, if you think about mammography, radiological suites that were there to help provide screening, some of them were even closed during the initial part of COVID. So there are estimates that for some cancers that we can screen for about six different cancers that their estimate's about 80% reduction in terms of the screening rates. And we know that that disproportionately impacts communities of color and also those in rural areas. And so we absolutely are worried about the fact that there may be some issues related to a later stage of diagnosis. We are certainly seeing that in our clinics. But more importantly, we are concerned that that may impact and further exacerbate some of the disparities that, as you've noted, were actually coming down, particularly related to Black white. There was a report by the AACR that came out in 2020 in September that actually showed that there was a nice decline in terms of the gap. That gap still exists, but now with the pandemic, we are certainly concerned that the issues related to access to screening will exacerbate some of the mortality and morbidity related to cancer for the disenfranchised communities.